Question 1. A nurse is prioritizing care for 4 oncology patients. Which patient should the nurse assess first? A. A patient with a hemoglobin of 12G/DL reporting fatigue. B. A patient with a white blood cell count of 1/500/mm superscript 3 reporting fever. C. A patient receiving chemotherapy with mild nausea. D. A patient post-radiation therapy with skin redness. Answer. B. A patient with a white blood cell count of 1/500/mm superscript 3 reporting fever. Question 2. A nurse is delegating tasks for a patient receiving chemotherapy. Which task can be delegated to an unlicensed assistive personnel UAP? A. Administering antiemetic medication. B. Monitoring vital signs during infusion. C. Assisting with ambulation to the bathroom. D. Assessing for chemotherapy side effects. Answer. C. Assisting with ambulation to the bathroom. Question 3. A patient with lung cancer reports shortness of breath. What is the nurse's priority action? A. Administer oxygen at 2 liters per minute via nasal cannula. B. Assess oxygen saturation and respiratory status. C. Notify the physician immediately. D. Encourage the patient to use relaxation techniques. Answer. B. Assess oxygen saturation and respiratory status. Question 4. A nurse is assigning responsibilities for a patient with neutropenia. Which task should be assigned to a registered nurse RN? A. Taking routine vital signs. B. Administering granulocyte colony stimulating factor. C. Assisting with oral hygiene. D. Transporting the patient to radiology. Answer. B. Administering granulocyte colony stimulating factor. Question 5. A patient receiving doxorubicin develops chest pain. What is the nurse's first action? A. Administer pain medication. B. Stop the infusion and assess the patient. C. Continue the infusion and monitor. D. Notify the oncologist immediately. Answer. B. Stop the infusion and assess the patient. Question 6. A nurse is caring for a patient with a central venous catheter for chemotherapy. Which finding requires immediate action? A. Mild redness at the insertion site. B. Swelling and pain at the catheter site. C. Clear fluid in the dressing. D. Patient reports mild itching. Answer. B. Swelling and pain at the catheter site. Question 7. A patient with breast cancer is receiving trastuzumab. Which side effect should the nurse monitor most closely? A. Nausea and vomiting. B. Cardiotoxicity. C. Peripheral neuropathy. D. Alopecia. Answer. B. Cardiotoxicity. Question 8. A nurse is prioritizing care for a patient post-bone marrow transplant. Which symptom indicates a potential complication requiring immediate attention? A. Fatigue and weakness. B. Fever and chills. C. Mild mucositis. D. Hair loss. Answer. B. Fever and chills. Question 9. A nurse is delegating tasks for a patient with leukemia. Which task is appropriate for a licensed practical nurse, LPN? A. Administering for chemotherapy. B. Monitoring for signs of infection. C. Developing the patient's care plan. D. Educating the patient about treatment options. Answer. B. Monitoring for signs of infection. Question 10. A patient with pancreatic cancer reports severe abdominal pain. What is the nurse's priority action? A. Administer prescribed opioid analgesic. B. Assess the pain's location, intensity, and quality. C. Encourage the patient to rest. D. Notify the physician immediately. Answer. B. Assess the pain's location, intensity, and quality. Question 11. A nurse is assigning tasks for a patient receiving radiation therapy. Which task should be assigned to an RN? A. Assisting with daily hygiene. B. Assessing skin integrity at the radiation site. C. Providing dietary instructions. D. Transporting the patient to the radiation suite. Answer. B. Assessing skin integrity at the radiation site. Question 12. A patient with lymphoma develops tumor lysis syndrome. Which laboratory value should the nurse monitor closely? A. Hemoglobin. B. Serum potassium. C. Blood glucose. D. Platelet count. Answer. B. Serum potassium. Question 13. A nurse is caring for a patient with multiple myeloma receiving bisphosphonates. What is a priority nursing intervention? A. Monitoring for alopecia. B. Assessing for bone pain and hypercalcemia. C. Encouraging high-fat diet. D. Limiting fluid intake. Answer. B. Assessing for bone pain and hypercalcemia as. Question 14. A nurse is delegating tasks for a patient with colorectal cancer. Which task can be delegated to a UAP? A. Monitoring for signs of bowel obstruction. B. Assisting with turning and repositioning. C. Administering laxatives as prescribed. D. Assessing nutritional status. Answer. B. Assisting with turning and repositioning. Question 15. A patient receiving cisplatin reports hearing loss. What is the nurse's first action? A. Continue the infusion and monitor. B. Stop the infusion and notify the oncologist. C. Administer an antiemetic. D. Encourage the patient to rest. Answer. B. Stop the infusion and notify the oncologist. Question 16. A nurse is prioritizing care for a patient with head and neck cancer. Which finding requires immediate intervention? A. Difficulty swallowing. B. Airway obstruction. C. Dry mouth. D. Fatigue. Answer. B. Airway obstruction. Question 17. A nurse is assigning tasks for a patient with a new diagnosis of ovarian cancer. Which task should be performed by an RN? A. Assisting with ambulation. B. Providing emotional support and education. C. Changing bed linens. D. Measuring intake and output. Answer. B. Providing emotional support and education. Question 18. A patient with prostate cancer reports urinary retention. What is the nurse's priority action? A. Administer a diuretic. B. Assess bladder distension and urinary output. C. Encourage increased fluid intake. D. Notify the urologist immediately. Answer. B. Assess bladder distension and urinary output. Question 19. A nurse is delegating tasks for a patient receiving immunotherapy. Which task is appropriate for an LPN? A. Assessing for immune-related adverse effects. B. Administering oral antihistamines as prescribed. C. Developing the patient's immunotherapy schedule. D. Educating the patient about immunotherapy risks. Answer. B. Administering oral antihistamines as prescribed. Question 20. A patient with melanoma develops a rash after immunotherapy. What is the nurse's first action? A. Apply a topical steroid cream. B. Assess the rash and document findings. C. Continue the infusion and monitor. D. Administer an oral antihistamine. Answer. B. Assess the rash and document findings. Question 21. A nurse is prioritizing care for a patient with esophageal cancer. Which symptom requires immediate attention? A. Mild dysphagia. B. Hematemesis. C. Weight loss. D. Heartburn. Answer. B. Hematemesis. Question 22. A nurse is delegating tasks for a patient receiving a blood transfusion post-chemotherapy. Which task can be delegated to a UAP? A. Monitoring for transfusion reactions. B. Checking vital signs before the transfusion. C. Assisting with positioning the patient. D. Verifying blood type compatibility. Answer. C. Assisting with positioning the patient. Question 23. A patient with liver cancer reports jaundice and itching. What is the nurse's priority action? A. Administer an antihistamine. B. Assess liver function and bilirubin levels. C. Encourage a low-fat diet. D. Apply moisturizing lotion. Answer. B. Assess liver function and bilirubin levels. Question 24. A nurse is assigning tasks for a patient with bladder cancer receiving intravesical therapy. Which task should be assigned to an RN? A. Measuring urinary output. B. Monitoring for signs of bladder irritation. C. Assisting with toileting. D. Changing bed linens. Answer. B. Monitoring for signs of bladder irritation. Question 25. A patient receiving fluorouracil develops severe diarrhea. What is the nurse's first action? A. Administer an anti-diarrheal medication. B. Assess hydration status and electrolyte levels. C. Encourage oral fluid intake. D. Notify the oncologist immediately. Answer. B. Assess hydration status and electrolyte levels. Question 26. A nurse is caring for a patient with a portacath for chemotherapy. Which finding indicates a potential complication? A. Mild bruising at the site. B. Occlusion of the catheter. C. Clear dressing over the port. D. Patient reports mild discomfort. Answer. B. Occlusion of the catheter. Question 27. A patient with renal cell carcinoma is receiving immunotherapy. Which side effect should the nurse monitor most closely? A. Hair loss. B. Immune-mediated pneumonitis. C. Nausea. D. Fatigue. Answer. B. Immune-mediated pneumonitis. Question 28. A nurse is prioritizing care for a patient post-chemotherapy with thrombocytopenia. Which symptom requires immediate intervention? A. Petechiae on the skin. B. Active bleeding from the gums. C. Mild headache. D. Fatigue. Answer. B. Active bleeding from the gums. Question 29. A nurse is delegating tasks for a patient with gastric cancer. Which task is appropriate for an LPN? A. Assessing for signs of gastric bleeding. B. Administering prescribed oral antiemetics. C. Developing a nutritional plan. D. Educating the patient about chemotherapy. Answer. B. Administering prescribed oral antiemetics. Question 30. A patient with cervical cancer reports vaginal bleeding. What is the nurse's priority action? A. Administer pain medication. B. Assess the amount and nature of bleeding. C. Encourage rest. D. Notify the physician immediately. Answer. B. Assess the amount and nature of bleeding. Question 31. A nurse is assigning tasks for a patient receiving palliative care for advanced cancer. Which task should be performed by an RN? A. Assisting with hygiene. B. Managing pain and symptom control. C. Measuring intake and output. D. Repositioning the patient. Answer. B. Managing pain and symptom control. Question 32. A patient with Hodgkin lymphoma develops night sweats and fever. Which condition should the nurse suspect? A. Tumor lysis syndrome. B. Symptoms of lymphoma. C. Chemotherapy toxicity. D. Radiation side effects. Answer. B. Symptoms of lymphoma. Question 33. A nurse is caring for a patient receiving targeted therapy for lung cancer. What is a priority nursing intervention? A. Monitoring for alopecia. B. Assessing for rash or skin changes. C. Encouraging a high-protein diet. D. Limiting physical activity. Answer: B. Assessing for rash or skin changes. Question 34. A nurse is delegating tasks for a patient with brain cancer. Which task can be delegated to a UAP? A. Monitoring neurological status. B. Assisting with feeding. C. Administering anticonvulsants. D. Assessing seizure activity. Answer: B. Assisting with feeding. Question 35. A patient receiving vincristine reports numbness in the fingers. What is the nurse's first action? A. Continue the infusion and monitor. B. Stop the infusion and notify the oncologist. C. Administer pain medication. D. Encourage hand exercises. Answer: B. Stop the infusion and notify the oncologist. Question 36. A nurse is prioritizing care for a patient with thyroid cancer. Which finding requires immediate intervention? A. Hoarseness. B. Stridor. C. Fatigue. D. Neck discomfort. Answer: B. Stridor. Question 37. A nurse is assigning tasks for a patient with testicular cancer. Which task should be performed by an RN? A. Assisting with ambulation. B. Providing education on self-examination. C. Changing dressings. D. Measuring vital signs. Answer: B. Providing education on self-examination. Question 38. A patient with sarcoma reports bone pain. What is the nurse's priority action? A. Administer prescribed analgesics. B. Assess pain characteristics and intensity. C. Encourage rest. D. Notify the oncologist immediately. Answer: B. Assess pain characteristics and intensity. Question 39. A nurse is delegating tasks for a patient receiving hormonal therapy for breast cancer. Which task is appropriate for an LPN? A. Assessing for side effects of therapy. B. Administering oral hormonal medications. C. Developing a follow-up care plan. D. Educating the patient about treatment risks. Answer: B. Administering oral hormonal medications. Question 40. A patient with multiple myeloma develops confusion. What is the nurse's first action? A. Administer an antipsychotic medication. B. Assess neurological status and electrolyte levels. C. Encourage fluid intake. D. Notify the neurologist immediately. Answer: B. Assess neurological status and electrolyte levels. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.